I can personally tell you that Narcan is extremely important.
In Wisconsin and across the nation, overdose deaths dropped significantly last year. That's according to recently released CDC data. A big factor in that drop is increased Narcan availability.
Whether somebody agrees with it or not, like, we all have the same end goal, and that is to, reduce the overdose deaths, which is happening. And so I'm amazed at the amount of people who have shifted their views and carry Narcan.
Amanda Tennyson operates a harm reduction program for the Winnebago County Health Department. Along with public health vending machines, the program helps get items like fentanyl test strips and Narcan into the hands of community members, both of which are funded mainly through large-scale state opioid settlements. And it's making a difference.
We are seeing a decrease in overdose deaths, which is amazing. But we have to remember that Narcan is just one piece of that puzzle, and our treatment and other community partners are also game in this.
Maddie Brager is a community health strategist. She says Narcan goes hand in hand with recovery, rehab, and treatment programs. You need all of them to continue to see success. But those programs typically rely on federal funding through SAMHSA, part of U.S. Health and Human Services. But now, SAMHSA is facing funding cuts as Robert F. Kennedy Jr. and the Trump administration seek to downsize government and spending. Wisconsin Democrats like Senator Tammy Baldwin are loudly expressing frustration.
They announced this massive reorganization of Health and Human Services and the elimination of different programs or agencies and the reconfiguration. And you know how much detail we got on that? Well, first of all, Congress got zero detail on it.
While Republicans like Representative Tony Weed say it's misinformation. He says in part, quote, as the Trump administration clearly explained and Senator Baldwin willfully ignored, SAMHSA will be consolidated and improved with other federal healthcare agencies to better serve those with chronic diseases and mental health struggles. But municipalities like Winnebago County say any funding cuts at any level could dilute the progress communities are making against the opioid crisis.
Even though that might not directly impact us with Narcan, those other pieces will eventually have an impact on other systems and other services, which we know will be devastating to our community.
In Winnebago County, Marlo Lundak, Fox 11 News.